It was a cool December night. Here in California, we don't really have those things called seasons. I remember we had made this plan to go on our first date. This nice little restaurant. Drove an hour just to make it easier on her. Pull up to the restaurant, go put our names in. We're waiting there for a couple minutes, and I get a text. She says, "Hey, something happened." Now, just having driven an hour for a first date, to get texted something happened was not exactly how I was hoping the night would go. And so in my head, I thought, man, you couldn't have canceled like 2 hours ago before I left. Her next text said, "I got a flat tire." And my thought was, man, as far as excuses go, that's pretty decent. But the next sentence is what surprised me. She said, "I'm actually down the street and my tire just went flat." So, being the gentleman that I am, I went down and I offered to help her. And I get in the car, and the first thing I hear is from her mom. And she says, "Hey, make sure that your friends get there first before this guy. We don't know, he could be a creeper or something." To which I'm quietly sitting in her passenger side seat, as I'd already gotten to her car, and her friends were nowhere to be seen yet, and kind of just shrugged it off and kind of laughed. And apparently, the next thing that happened, after she turned down the volume on her phone, realizing that I could hear the whole entire conversation, was, "Let's see what this guy's made of." It was a fun night. We backed the car up, I got out, and I was able to help change her tire, and we had an amazing rest of the night. The funny thing was that she didn't actually know that she had all the tools she needed to change her tire readily available in her trunk. She just had to get out of the car, get the tools out, put them on the tire, and swap over the tire. But even though she had the tools, she didn't know how to use them. The last 3 days we've spent discussing tools that are in your tool bag. Today, we're going to wrap up that conversation, put a little bow on it so that you know how to start the process of testing your patients for sleep apnea. But at the end of this, we want to challenge you. Are these all the tools that you need? Or is this just the start of the process? But let's dive in. Let's look at, how do we conclude this conversation, and how do we get the patient to move forward with saying yes to a home sleep study?